Hi, David.
Hello, sir.
Hi. So, a couple weeks ago, we did the Intracept procedure on you.
Correct.
And you're doing very nicely, right?
Fantastic.
You can't believe how good you feel,
Right.
Okay, fantastic. And you've had this pain since about 2010. So you've had this for 15 years. And it's just been kind of steady, constant all that time. And you've tried a lot of different treatments to help this. In fact, one of my ex-partners treated you about 8 years ago, and you had radio frequency and sacral joint injections and epidurals, and that didn't help. And then you had treatments out in Colorado, and that didn't help. You even had some spacers put in your lumbar area, that didn't help. So I'm kind of surprised you kept up hope.
Well, it came so quick after the procedure.
Yeah, right. Mm-hmm. And but basically, when I looked at David's MRI, he had some MODIC changes there. He had typical changes of the vertebrae, and when we see those changes in the MRI, then we have a hint where the pain's coming from. And it was actually pain coming from the vertebrae themselves. There are first, if you have disc deterioration, then the deterioration starts to get into the edges of the vertebrae, and then that irritates or causes transmission of nerve fibers, which then are sent into the spinal canal and causes back pain. And what we're able to do is do a heat lesion, and we did it at L4, L5, S1 on you, and we knocked out that nerve that's transmitting the pain. So we short-circuited the pain signal. So we're able to diagnose it, and then we're able to treat that. And so you had about 6 or 7 days of pain afterwards.
But it was less every day.
Less every day. I think you took like 10 or 12 pain pills after the procedure, and it was very manageable.
Okay.
And then after a week, not much procedural pain, and now you're 70% better, a little over 2 weeks.
Right.
And as I mentioned, this is a durable treatment because this should last the rest of your life, because it's a one and done procedure, which is so wonderful. So we've identified a pain generator that was missed in the past. We didn't have treatment until about 4 or 5 years ago for this. And we've addressed that, and you're doing so much better, and I think you continue to do great. So fantastic. Thank you. For anything else you'd like to add about the procedure or the story?
It was a procedure that I didn't think would work because nothing had ever worked.
Right, so you were a little hopeless.
I was a little hopeless, but then after about the first week, the next week, which is now, pain's almost all gone.
But someone said something to you about me.
Right. A friend of mine said that you would continue until you found the cause of the pain, and you did.
I think that's one of the things I'm known for, is not giving up and trying to keep looking for the source of the pain.
And
so
too many people just want to shoot you and send you on their way.
Yeah, well, if something's not working, you have to figure out why. So absolutely.
And, I'm very impressed.
Great.
Thank you.
Well, thank you for sharing your story with us, and great luck to you. Have a great trip.
Will do.
Okay, thank you.
Thanks.